So good morning, everybody. My name is Christof Chwojka. I'm the chair of this session, and I will delay anything. We'll start with our track remote call taking, and the first two are Michael Kelly and Ciaran Moynihan with their presentation. It was nearly right, huh? Sorry about that. Introduce yourself and please start.
Obviously, we're all familiar with what happened in February 2020. COVID struck, and we'd no idea how long or how big an issue this was going to be. Our government, probably quite dramatically, asked us to be prepared for 50% sickness levels, or at least 50% absenteeism. And really, when we looked at it, we needed a solution because we could not see how we would be able to operate with only half of the staff. So our approach fundamentally was that we avoid staff becoming ill as much as possible, and we did that in a number of ways by making sure that staff didn't mingle, they didn't associate with each other in centres. Obviously we had social distancing. We banned all visitors to site. Up to that point we would have quite a few members of emergency services coming in and out of centres, and that had its dangers. And we wanted to introduce remote working for at least 50% of staff so that they could work either from some sort of a smaller centre or preferably from home. And the other thing that we did was all data and evidence requests, because we have a very large legal role, that was moved to electronic transfer. So what did we do? We needed an instant solution. We needed it now. We'd never ever taken calls remotely. They were always taken in centres. So it had to be this quick. We brainstormed a solution on Wednesday. It was designed including the security the following day. It was built really over the weekend, including the testing, and the first calls were taken remotely on Monday. And it really did need to be that quick. Not all staff had laptops because they were working from workstations in centres. So as you will probably remember, a lot of this IT equipment was now in short supply across the world, but we did manage to get 60 laptops delivered. And for those staff who didn't have broadband already, we got it ordered. But on top of that, we also found, for a variety of reasons, that we needed mobile broadband solutions as well, and we needed to advise on Wi-Fi. And first and foremost, it had to be said, the caller, the person dialing 112, should not be aware that the person they were talking to was actually working from home. So there had to be no impact on the caller, and of course it had to be totally secure. So the immediate challenges we faced were, we were up to that point we were managing 2 centres, so everybody was within speaking distance of each other. So that presented problems. How do you communicate with a staff member who is on the phone to a caller when they're working from home? And we needed to be able to deal with issues on calls. There's going to be technical issues and so on. So we introduced instant messaging for that. And we actually found that to be a really, really good solution, and one that we have kept for lots of reasons for now on. And also then we needed to coach or train staff. If staff are having difficulty, or if they were new, they needed to be coached, as we call it. Medium term, we knew that there were challenges in terms of recruitment. We were just about to bring in new staff. There were going to be difficulties with training them, and then also the performance management of staff as well. And then we also had to have an agreement with staff. We were paying for the broadband, so we didn't want anybody using Netflix in the rest of the house while calls were going on. And also it needed to be a quiet environment, again for obvious reasons. So I'll hand you over to Ciaran now, and he'll talk about the actual solution.
Thanks, Mick. So yeah, how do we do it? As Mick said, we pretty much rolled it out over a weekend, but how did we actually manage to do it? Basically, we got lucky. We got lucky with the design choices we'd made over the years for our platform. We had an all-IP platform, right? So enabling remote access was simply, you need IP access. We had recently upgraded our firewall infrastructure, and that was VPN ready. So when Mick says that over the weekend it was developed, that was the network guys, the firewall guys, and our engineers building laptops and building the first test laptops to get it tested and out there. The other kind of design choice that really helped us, and these are choices that went back 13, 14 years, was we had doggedly stuck to a single screen over the years. So for full call taking capability, all we needed to get out to a remote worker was a laptop, one screen, USB headset, and any USB headset will do it. We supply them. We also have sort of a custom, it's a custom keyboard. Our operators like it. It allows them to perform call handling functions really quickly, but it was optional. You can handle calls without it. So, as Mick said, we managed to get 60 laptops in a hurry. The rest of the equipment, keyboards, screens, USB headsets, we stole them from everywhere. Our training facilities were decimated. Stocks, spares, they were all gone. So, remote working was something we had said we'd never do. And the reason was kind of, I think, security was our biggest concern. We didn't want, as many of you won't, access to our platform from an uncontrolled environment. It's just too difficult to manage. But when we actually looked at what was involved, it became clear that it's actually not that bad, because we store no data locally on the workstation. So if the workstation goes missing, it's not that big a deal. We can simply turn it off. We don't care. There's no data on it. Nothing is compromised. We also have AD, which manages our users. We can turn off a user if a user is compromised. We don't trust them anymore. They can be turned off in a matter of minutes. The other thing we implemented was geographic IP restrictions on our firewall. So you can only connect to our VPN, connect to our platform from an Irish IP address. Slight risk with that, but it has worked for us. Standard security measures that you'd have in a call center, or in any system, we have them in place. All access is logged. We can see who's using the platform at any one time. And that's actually, it's kind of a key feature that nobody considers when you're working in a call center. Our network was completely disconnected from everyone. So we know that the people who were using our platform were the people we could see in our call centers. When we move to an uncontrolled home-based environment, do we know if the right people are using the platform at the right time? Well, actually we do. We can see who's logged on at any one time, and it's exactly the same as standing up, looking around the call center and seeing, okay, 2, 3, 4, 5, 6, they're all logged on. That's who's supposed to be logged on. We did have a slight concern with, somebody may be logged on, accessing the system, possibly listening to call recordings that they shouldn't be recording, or they shouldn't be listening to. If they log on outside of their shift, their colleagues are going to look at them and say, hey, what are you doing logged on? You're not supposed to be working. So, yeah. We were working on the platform and developing the remote access solution, but the service management team were simultaneously working on, okay, how do we coordinate this workforce? How do we manage a team that's spread across 2, 3, 6 different counties? We considered a variety of solutions, including WhatsApp. The big challenge with these is that these operators are on calls. When they're in a call center, they can put up their hand. If they need help, a supervisor will walk over to them. It doesn't work when you're at home. So we very quickly realized when we started talking to started getting involved in the service management discussions that we needed an IM solution. And luckily enough, we didn't have one, but we had a system that was capable of rolling out an IM solution, which again was done pretty much over a weekend. That has proved incredibly successful. The operators love it. It means that communication about issues on calls, communication about people taking their breaks. All of that is more seamless, and it's the sort of thing we look at now and we wonder, well, why didn't we do this years ago? It really has improved the sort of working environment and the way the teams can be coordinated, no end. And finally, the other thing that we realized very quickly we needed was the operators, we can give them a call handling application. They can handle calls, but they also need to know what else is happening in the service. They need to know who's logged on, who's on their break, what does the queue look like, can I take my break now, is the service level in trouble, do we all need to keep working, keep taking calls as quickly as we can to get the service level back to where it should be, etc. So all of that information in any call center, it's up on a big screen like that on the wall, and the operator just looks up from their workstation and say, oh yeah, Mary's taking calls, John's ready, I can take my break now. But when they're in the spare room, or they're in their kitchen or wherever, they don't know who's working. They don't know if they can take their break. So we basically very quickly developed a set of dashboards. And yeah, they proved very successful as well. So how did we get on? How did it work? Surprisingly, I think we surprised ourselves in that we actually maintained our KPIs. I think Mick will talk about the call volumes that we saw. So when COVID hit, there was an initial, and when everyone was told to work from home, there was an initial spike of calls. Mostly people didn't know who to call. That's been discussed in other presentations here. The experiences of other countries was the same, I think. But once that sort of initial spike of calls passed, then service levels kind of returned to normal, and it actually wasn't too bad. In terms of managing the remote working solution, managing the remote workers, yeah, that did get more difficult. It is more difficult for an engineer to deal with a fault or an issue on a workstation if they can't walk up to the user, discuss what happened or what's going wrong, investigate the problem there and then. So that is more difficult, but we have found ways around it. Particularly, we use screen recording quite extensively. So if a user reports a problem, often they don't communicate the problem very well. If an engineer can walk up to their workstation, he can see what's going on. But when they're at home, he can look at the screen recording and he can see the issue. Hardware, yeah, it is a challenge. We've sort of developed spares, kits that can be easily swapped out. And that, it still means the operator needs to drive to the center or a manager needs to drive to their house and replace their kit for them. But it can be done by a manager. It doesn't have to be one of our engineers. As Mick said, we had broadband was our biggest challenge, and quality broadband. So we've had to work with a small number of operators, but it's only been a handful really. And we've sort of addressed that with providing mobile broadband, providing advice on Wi-Fi, make sure your 13-year-old isn't on Minecraft while you're taking calls, that kind of stuff. And that's pretty much it really. We're constantly looking to enhance the solution. On the security front, we're looking at putting in place multi-factor authentication. And on the sort of connectivity side, we're looking at possibly using mobile broadband as a backup or a fallback connectivity solution. Our big concern is sort of a widespread broadband failure, but fingers crossed, that hasn't happened yet. So I'll hand you back to Mick for the last slide.
Okay, we're almost out of time.
We are, sorry.
Sorry, just very, very quickly. I'll skip over the first point. I think the lessons we've learned is, look, don't waste a good crisis, and we didn't. We'll never return to 100% working in centres. It's just never going to happen again. Staff satisfaction has increased. I don't think that staff have ever been happier because of the flexibility that it provides. However, I would say that the management of staff is more difficult. It definitely takes more out of our managers. They spend more time doing it, and arguably the quality is not as good. But we're making it work. I would also say that remote working or remote training does not work. We did try it, it didn't work. You need to bring the people in physically. They need that coaching, that training face-to-face in the first few weeks. But also with some of the capabilities that we've built on the remote working side, we can allow them to do a certain amount of work from home. But I suppose what I would want to leave you with, or what both of us want to leave you with, is the first point. The remote working has wider application. So it's not just about COVID, it's not about contingency planning only. It does have a huge contingency response capability. Luckily, we don't suffer from bad weather, but when we do, I think from now on, we will encourage staff to work from home and not to travel. And also, just to point out that it's very, very useful for overtime and to fill in shifts where people don't show up for whatever reason. Staff can log on within 5 minutes, and that's a huge benefit to our business. So that's all we wanted to say. Thanks very much. Thank you.
Thank you very much. It was really impressive, and as I expected, Ireland has always a very flexible way to go to problems. So are there any questions from the audience? Nobody wants to be the first. I have a question. How many people have been in home office? So in general and in one shift?
In one shift, we would have up to 10 or 11
and
people.
If you would say how many of your personnel is home office ready in percentage?
100%.
100%, so everybody is allowed.
But everybody has obviously a workstation and a position in a center, but in addition, they now have a laptop, which we encourage them to have in the trunk of their car.
Perfect. Perfect solution.
That's also, it's also important for these users that have laptops. We ensure that they actually test their laptop solution on a regular basis. That's absolutely vital. They may prefer to work in the centers, but we ask them to, can you take some calls on your laptop today?
So once again, thank you very much. It was really impressive. We go to the next speaker, and I need my glasses. So the next speaker is Fabrice Dami from he's the medical director of the Lausanne Emergency Dispatch Center in Austria's neighborhood country in Switzerland. So let's hear what you have to say.
Okay, good morning everyone. Thank you for the EENA for the invitation. I'll be shorter than my colleagues. I'll be less technical because I'm just a doctor, so I don't know all the things they know. Today I just want to tell you just a story, hopefully an interesting story. Yeah, I have no conflict of interest, unfortunately. So, as many stories start, once upon a time there was the tiny little Switzerland in the middle of Europe, surrounded, as mentioned, by many, many big, huge countries, Germany, France, Austria. Well, we're missing Liechtenstein right here. But well, very small countries, so lots of borders. And if we get a look closer, that's where I work. That's the zone that our dispatch is taking care of in the French part of Switzerland. And if we get even closer, that's our territory. And well, it doesn't show very well on the map, but on the other side of the lake, Geneva Lake, there is France. So, a bit of economics. Switzerland is probably one of the countries with the higher incomes, but with higher income comes higher costs. Rents are very expensive, insurances, I'm not going to tell you about that. And even food, drinks, everything is really, really expensive. So that's why many people, well, they want to work in Switzerland where they have a high income and live in another country where the costs are lower to increase their buying power. And well, it sounds very nice, but can be some of a problem. We have a small dispatch, only 30 dispatchers, and well, the problem comes here. Half of them live in France, and they cross the lake every day. So probably you see me coming. Then what happens? COVID arrives, first wave, and there are big talks about closing the borders. And oops, what are we gonna do if our workers cannot come over to work? We would not be able to pursue a mission without maybe losing half of our personnel. So, as our colleagues, quick thinking over a weekend, what to do. Okay, let's think. Maybe we could have some of our dispatchers stay in Switzerland. Okay, we can get hotel rooms. We could keep them in the country, but for how long? Away from their family, 1 day, 1 week, 1 month? Is it really possible? We also thought about training paramedics because some of them could not work on the field anymore because of pre-medical conditions, and to turn them into dispatchers, because in our system we need at least nurse or paramedics to be dispatchers. And also, of course, set up remote working station like probably everyone did in this room. So what we did, we booked hotel rooms. Okay, for a month, we didn't know how long the crisis would last. We trained just 3 paramedics. That's not a lot, but that's still what's still interesting. And of course, we set remote working station if the border closed or if there are problems with quarantine. But that's the interesting part of the story. That's we did set remote working station in France, but don't tell anyone. That was quite a risk. But that was probably the only solution we could imagine that would really allow to pursue our mission. So we did something bad. We didn't tell or ask permission from health authorities. Well, they had a lot to do with the COVID, so they were quite busy. And we were pretty sure they would just say no. So that's why we didn't ask. But that was quite complex. We had some of the technical issue from our colleagues here, but changing the country, working from another country, adds some more problems. First, radio. Usually the radio is a national system, so we couldn't have a radio, our radio system, our Swiss radio system in France. And what the problem also was to get the incoming calls from Swiss citizens get into France with another phone provider. That was a problem too. But we had to do that anyway, so we had to find a way. So what we did, the remote people, either in Switzerland because they were in quarantine or in France, would just treat the back office of incoming calls from other professionals. When paramedics have a question, fire has a question, police has a question, they would take care of this back office calls, but they would not take care of the emergency incoming calls from Swiss citizens. Also, we had no radio and we had no recording of those calls. That's why we could not take care of the emergency calls from Swiss citizens. And as mentioned too, those people had needed to talk together, to communicate, because in the dispatch, well, they raised their hand, as mentioned. So we implemented chat within all those places, and we used the product Slack that some of you may know. So we were ready, we had solutions, but the good news is we did not have to implement it because we only had 2 people sick and 2 people in quarantine during the first wave of COVID. So it was not necessary, but everything was tested and it worked. And I want to say, well, I'm also an HEMS physician. We have to be creative. This is pre-hospital care. It's like being in the field. When it doesn't work by the book, well, you do it another way. So it has a cost. We took a risk. We didn't ask the permission, but we will probably do it again because the priority is to pursue the mission. One thing we learned from this crisis is we probably need to do everything we can to increase dispatcher's salary in Switzerland, so people living in Switzerland would apply to become a dispatcher, because today most of the people applying live in France, and it doesn't matter if they're Swiss, French, or from other country, but we need people in Switzerland to apply, so if the border closes, which hopefully will never happen, we won't be at risk anymore. That's it, short story, hope you like it, and I'm available for any question.
A short but a good story, and now your state authority knows everything, because I think that's recorded. And
no problem, we published it before, but I don't think they read medical papers anyway. So maybe they know, but they don't want to say they know, otherwise they would have to do something.
Yeah. So, do you have any questions? Yep. Is there a microphone? Yeah, mic is coming.
Don't run, never run.
Maybe it's more a question for you. You also had people working from neighboring countries, right? Did you also have the same
The big difference between Switzerland and Austria is we are part of the European Union, and so there are different laws which is based on it. Yeah? And it's really a border between them, and normally we don't have a border between Austria and Czech, Austria and Germany, Austria. Normally we don't have even a border between Austria and Switzerland, but there are different laws apply. And what I said yesterday is we have big distances within Austria, 500 kilometers from east to west. So I have call takers in the western part of Austria, and it's simply not possible to go every morning from Innsbruck to my place. So that's a reason. And yes, remote call taking is possible from anywhere. And if there is a call, for example, in Czech language, we are transferring this call into a conference call with a Czech center. So they can make the call, give us the data. So everything is possible. But I have a question to you. How long did you expect that the crisis would be in the beginning? Because of your idea of hotel rooms, what did you expect in the beginning?
Well, we really didn't know, but we suspected it would be long. So I know my colleague from Ticino, I don't know if there are any here, it's an Italian part of Switzerland, they had the same problem because most of the people, some people in the dispatch come from Italy. So we didn't know. We had a hope, and it realized that the border would not close, because if the border closed, all the Swiss hospitals around the borders, I mean Geneva University Hospital, Lausanne University, they can close because 60–70% of the nurses, they come from France. So we knew that probably we would not be the major problem. So we had a hope it would not happen. It did not, but we expected it would last for quite long. A pandemic.
And would you say it's a nationwide problem in Switzerland? Because in Bale, for example, it might be the same, huh?
Exactly. I showed you. Small country, so lots of borders, so a lot of area in Switzerland that are close from a border, so a lot of workers from foreign countries, because of increased buying power, come to Switzerland, work in Switzerland. Maybe we should move all our dispatch to France, Austria, and Germany, and that's it.
Yeah, if we get the payment we would get in Switzerland.
But we talk about that later.
So thanks once again for your impressive and really short, impressive story. And we will move on to the next speaker, Yann. The floor is all yours.
So I guess my presentation is more about a wrap-up, understanding that the effects that we've seen and the responses that our colleagues have shown us are effectively the new normal now. And I've coined this phrase from what Christof said in his opening speech, when he talked about this is the new normal. It's not just a crisis. There are lessons learned here that are going to be persistent. So when we look at some of the problems that's created, it wasn't just about social distancing and the need to move people apart for their own safety and welfare, but also to retain the operational flexibility of the control rooms. It was also recognizing that the IT services that were originally delivering service weren't really up to the job of addressing this kind of problem. Remote working, and we've seen lots of solutions today, and I've been walking around the conference talking to other attendees. Remote working solutions were either in place many years before, as in Christof's example, or hastily brought together by talented IT professionals to try and plug that gap. But actually there needs to be a recognition that the systems that were put in place to deliver services day to day before this really are up to the job of delivering this more flexible, more remotely robust system. There were many bright sparks. There were not all bad news. There were organizations that were already doing home working, that were already looking at the idea of remote dispatch or remote centers. So some of that work had already been done. But at the heart of the problem in most cases was that the idea of a control room was that. It was a room, it was a dedicated resource in a specific geographic location. And the photograph up there may be reminiscent of many control rooms you've seen or visited. Hardwired in, lots of servers, a need for dedicated communications. And in pre-COVID environment, this was what we'd see in most control rooms around the world. But it's very hard to move, it's particularly inflexible, it's made up of multiple individual systems that require a lot of IT maintenance and support, making it very difficult to move away from the place where it's set up to be supported. So if we move from a dedicated location, what does the world look like now? What could the world look like now? Well, it could look like a virtual control room. Now this is a little technical, but I'll just take you through the main blocks of it. You have a control room capability, a platform that is hosted centrally. I'm not using the word cloud, because that could be one solution, but generally a system that could be located in a data center or a cloud, or a facility that can be accessed via a wide area network or WAN. All calls come into that that center, all radio connections, whether that's broadband, push to talk over 3GPP or Tetra or any other kind of LMR system is connected there as well. So all of the consumption of communications is available within that control room platform. It's accessed via broadband, it's accessed via dedicated lines, so that the individual organization, in this case in the diagram organization A, has access to all of the functionality that would normally be available in the control room. But better than that, through the use of VPNs, we're able to then set up remote workers on the left-hand side, wherever they need to be, and set up correctly. These could be 500 kilometers away, as in Christian's example. They could be in different countries and different parts of the world. They still have the same access as if they were in the same building. We're able then also to look at using profiles to allow other agencies access to the same capability. This is where you may have an explosion in demand, where you just don't have enough staff able to take on that capability, and a partnering agency using the same kind of virtual access methods can now access the same capabilities as you're giving your staff. And that delivers a very different experience now. It allows you to deploy control room functionality, the full range of that control room functionality, wherever is most appropriate. A home working environment with a single screen or multiple screens, a workflow that is designed around how the operation needs to move an incident forward, rather than the operator having to pick out information from individual systems and stitch that incident together. And these platforms are available now. We've seen some of our customers and even some of the presenters using aspects of it, but actually planning for an entire control room to use all of the features so they have the same functionality going forward is something that industry needs to step up and help you with. But it's not just about technology. There are lots of challenges that you as the agency need to address, or at least need to consider before moving down this path. One is profiles. Profiles of the people, meaning what access are you going to give individuals, and what access do individuals need to be able to do their jobs more effectively. So understanding that there are specialists, there are supervisories, there are generalists that will need to have different access to different functions. Persistence is a really big one, and it was mentioned in a couple of the case studies that we heard this morning. So when you stop using the application, when you log off at the end of the shift, when you go for a break, how much of the information is still left on the laptop or on the device you're accessing from remotely? Because that is very sensitive information, as we know. So how do you manage that persistence? How resilient is your ability to connect? We heard from the Irish case study the need to look at not just broadband as an access method, but backup methods in case of a primary failure. Is that being planned into your network access? Privacy, and this goes beyond just having a VPN. Is physical privacy even possible? Can you can you have a quiet private area where calls are being taken, or is the kitchen the only place that the operators can set up in order to make these calls? Now that again is it's a personal consideration about what you do to ensure that you've secured that privacy. Access to the system, two-factor access, biometric access, these are all really things that, again, are part of the security process and operations of an organization. But if we're going to take this seriously going forward, it's going to be got to be hard-coded into how we deliver this technology. And then the two most important things, the processes to support this remote working has been thrown together very quickly, and in most cases, but where it's been very, very successful is where it's been developed over time, where it's been purpose-built to support people remotely working. And that means perhaps an organizational change. We heard about the challenge for managers managing remote staff. It is much more intense, it is much more difficult. There are different tools that need to be put in place, different processes that need to be developed to get the best out of the staff in that remote working environment. But then finally people, and that's the heart of this. We shouldn't just be doing this to protect them. We should also be looking at the ongoing welfare and retention of those staff. Again, two great examples we heard about staff coming in from other countries or other environments or other economic areas can be attracted if we're able to give them the ability to work from their home environments in a much more flexible way. It also gives the ability to rapidly staff up at moments of crisis without waiting for an hour, 2 hours, 5 hours for somebody to drive in to start a new shift. So it makes a great deal of sense that this is the new normal, because a lot of these working practices make a great deal of sense in day-to-day development of our operational services. But how did we hear this from our customers when we talk to them? Yeah, we hear from them in conferences like this, but I think for us the strongest way we hear from them is when we actually answer RFPs or take part in any kind of tender. And over the last 18 months, we've seen a dramatic difference in how tenders for control room environments have changed. We had 15 different tenders come in for the control room with thousands of individual requirements, and we spent a lot of time analysing those requirements afterwards to kind of boil it down to 470-ish repeating outcomes that are being required from these tenders. And many of them are the same as they've always been around availability and functionality, but many have changed. And as we did this analysis over 20 different subject areas that we're focused on, we came up with 5 emerging trends where the needs have significantly changed from where we were seeing tenders or customer requirements before. And we've also then distilled that into 3 emerging or strategic goals, so at a much higher level what they're trying to achieve over the 5-10 year period of making this investment. I won't read through all of these because it's quite text heavy, but you can have the presentation afterwards. But the obvious ones are ones that you're hearing in all of these presentations, and also as you talk to your colleagues.
I just wanted to say that everybody wants to make a photo because it's really interesting. You will get all these starting on the 25th of October. I've got his presentation before, it's in his presentation. So.
Okay. So 5 shifts in control room requirements that we've seen have repeated themselves through all of these tenders. First of all, we were used to the idea of customers saying they wanted a fixed capacity. So we want this many seats, and we want a primary control room, and we want this dark site or this backup site over here. That has been the method of buying these control room upgrades for decades. Now it's about dynamic capacity. We're not sure when and how much, but we need to be able to scale up quickly and scale down quickly. We need to be able to work really effectively with other supporting agencies and give them the same or similar access that we have to the information that's coming in. There needs to be, the second one, physical command and control room. Again, this idea that it is a room in a building that we will hardwire and we will be supported with remote engineers. That has changed dramatically into it's now a function, a control room function, not a room. And we need to be able to access it from anywhere, not just people's homes, but maybe remote locations, maybe schools, maybe council offices. And we need to be able to do that quickly. We need to be able to set up with brand new infrastructure or brand new console positions immediately. And that device, we don't want to restrict ourselves to a particular device. In other words, have a constant stock of one particular type of laptop or computer. We want to be able to access from laptops, desktops, tablets, if that makes sense as well. Other one is about the contact with the general public. So again, most of the communications was voice, and there's been a lot of talk about mobile and getting additional information from mobile networks, but actually that's not how we live our personal lives. Our personal lives are much more multimedia. They are web chats, they are WhatsApp, they are video calling. And this now needs to become a core of how we take information from the general public and deliver those services. So multiple communication channels, potentially within the same conversation, switching between a voice call and a video call and uploading pictures are all part of a general conversation that's much richer with citizens. Predictable growth in demand for service. So when we previously worked with customers, they had recognized that growth in population was probably the largest indicator of growth in service, tied one to the other. But now we've seen already in this coronavirus crisis, numbers that would just completely blow that out of the world. Exponential demand for calls. And yes, that will drift down as we start to move away from the crisis, but there's still got to be the ability to deal with that exponential increase in demand, and whether that's the changing role of our frontline agencies, or whether it's crisis like this that cause pockets of demand. And then the other large change was a move away from best-of-breed products, so individual systems that will be put together by a systems integrator, which caused a huge amount of complication, instability in the system, and most importantly for our agencies, a large cost component, as these systems would each individually have to be upgraded and then synchronized. A move from that into an integrated platform. So a platform that is deeply integrated, that is focused on the workflows rather than the operator being the systems integrator. And the last slide, I think I'm on time, yeah I am. Were the strategic outcomes. And this was a distillation of, if you're going to spend 5 years or 10 years in a contract with a new supplier, and you're going to make all of this time investment and financial investment, what are the real outcomes you're trying to achieve? And there are lots of individual ones as you'd expect from each project, but in general it kept coming back to these 3 areas. So recognizing that there was an awful lot of information coming in to the organization that would have to be processed very quickly. If we wanted to reduce the strain on the operators, then we needed to find a way of streamlining workflows. And this is an evolutionary process. You can't do it on day one, you can only do it as you know and learn more. So streamlining workflows was a constant theme. Workplace mobility. This is not mobile, as in everything on your mobile phone. This is the ability to transform the workplace into wherever is physically most applicable. Being able to take it into remote sites, into schools, into council offices, We've seen examples of that in the conversations that we've had over the last couple of days, but that is going to be an ongoing theme, that operational flexibility to deploy services where you're able to deliver them. And the last one was, as we picked up from all of these stories, the need to evolve quickly against operational outcomes. So most of the previous ITTs that I've been involved in over the last 20 years have kind of set a goal, maybe put a few things in a roadmap, and that was the end of the journey. Well, we've got so many black swan events or new events coming in that technology needs to be much more adaptive. It needs to be much more of a partnership which starts to recognize what are the big operational challenges for the next 6 months, the next 3 months, or actually the next month, and start to evolve the solution to be able to address those challenges. So much more of a partnership, and that sounds like a cliche, but much more of a relationship between suppliers and customers to evolve the service in line with new operational demands. Hope that was useful, and I think I've just run over slightly. Sorry, Christof.
It was very useful. As you've seen, everybody wants to have photos of your slides, so it was very interesting. What are your questions to Yann?
If you don't have any, they're all in the
I will have one, a very provocative question. Why is the industry still selling the old stuff and not the new ones? And the second question, why are tenders of comm centers so old-fashioned if we know that everything has to be home office ready right now? Or
so two really, and they are provocative questions. I think we as an industry, quite slow moving. If you're going to change the code base to be flexible like we all now need, you needed to start 2 or 3 years ago. It takes years to recode something to work in the cloud or work purely on browsers.
Yeah, but they did it in 1 weekend.
Through lots of different other products.
I want to be provocative, right?
No, and we should do this. So you're right, but those are products that were made purely in the cloud by people not in our industry. So you were forced to go outside. Now I think what's happening now is if you go out there, everybody is trying to move fast into this new world. Some will have that'll be a much longer journey for some who haven't started early enough, and a much shorter journey for others. But it's the kind of questions that should be asked in terms of the tenders. I've seen, the reason why I did this presentation, I've seen that dramatic change in tenders now, that they're asking for a much more flexible, dynamic systems. So I think having people who have been through this experience of home working or flexible working makes sense, not just for pandemics, but for going forward. It just generally makes sense. That's starting to come through now. I think there might be a mismatch between industry and expectation, but we'll see in the next few tenders as they come through.
Is there a question? I have another one, another good one.
Please.
So the next one is, it's a question to everybody maybe, where is then the border of home office? I allow home office for people within Austria, within Germany, within Czech. So if you're an Austrian, if you're an employee and you're living there, you can do. But what is the next step? That I engage people here in Latvia or in India, like other call centers did? So if you're calling the support of, I don't know, HP, in Austria, you get to a German-speaking guy in Latvia. And if you are calling Austrian Airlines and you want to do rebooking, somebody physically in India is this the future of?
Well, the technology
allows, yeah.
The technology allows it, so it comes back down to the people and process. It's whether you want that to happen.
Maybe if you don't tell, like you did.
Yeah, don't tell them, right.
So I'm not sure where the borders are. I don't know. We'll see. Yep.
Am I on? Yeah.
You're on.
Yeah.
Okay.
I think the problem is politics, because technology advance. We are customer. We want things to go forward, but the politics are very slow moving, and they don't want. They think it's so sensitive. They don't want this to be far away from their place. You can probably it when you want to merge two dispatch from two different communities. Wow, that's sometimes it's 10 years, 20 years, 30 years of talks, because people think they will maybe die if somebody from the other county takes care of you. So the problem is politics and maybe also finance. If there is less money, then probably politics will be eager to find a cheaper solution, but otherwise they will stick to the old ways. They don't want change.
Absolutely. So, if there are no... Yeah, there's a question.
Thank you. So Gary at EENA here. Question to you, Costa, actually. So I live, just background about me, I live at a place at the south of Belgium at the border with France and Luxembourg, and many of my neighbors, I mean actually almost all of my neighbors work in Luxembourg, so it was quite a trouble with finances because normally there was an agreement, a bilateral agreement between Belgium and Luxembourg where people could get the salary of Luxembourg and the benefits from Luxembourg only if they worked physically in Luxembourg. So they had to extend and adapt to COVID and make an exemption for a year. So how do you do, Costa, with your employees working from Germany and Czech Republic? How are the bilateral agreements between the countries? How much do you pay them?
They are employed in Austria. They are paid like Austrians because we are nearly like Switzerland, a high-income country. So as an call taker in the Czech Republic, you get only less than 30% of the income, and from where I'm living, it's only 15 minutes to Czech Republic. They pay the same price for gasoline, they pay the same price, but the income is really lower. So everybody wants to be paid on Austrian basis. Within the European Union, it's absolutely no problem because social security, health is common in the European Union. It is a problem with non-European Union countries. And if on the other side, you can found a small branch in the other country, that's also no problem. Everybody can found a branch. We are in Europe, you can do what you want within Europe. So there are no problems if you don't make it to a problem. So there is a solution. Don't search for problems as long as then it's not possible. It is possible, and it's easy possible. That's my message. Just do it. And in the pandemic, everybody expected from all the comm centers, especially the politicians, they expected that we are working perfectly. They don't want to know how within the pandemic. And after the pandemic, we have to make sure that we can continue like this, that nobody is raising his arm and saying, maybe there is a problem with this, maybe there's a problem with that, and because of this we don't want. The union in Austria, they are fan of home office. In the afternoon, and that's a short advertisement on own behalf, at 3 o'clock in track 2, I have a 15-minute speech about I love my company, and we have a different way of motivating our people. Maybe it's interesting for you, and there we'll be talking a little bit about this. But our message could be, it's possible. The pandemic made it possible within 1 weekend, and yeah, we should keep it like it is, I think. Any more? So, it was really interesting, also for me, for everybody, I think. Thanks to the industry, we are awaiting your new products within the next weeks. Thank you very much. I want to have modern call taking on an iPad. Most of my call takers are 19 to 23. They don't need a computer, they don't have a computer, they have tablets. And they are faster on the tablet than we would ever be on a computer. So give us new products, give us new opportunities. Thank you very much. Thank you, everybody. The session will continue in about 5 to 10 minutes. They are disinfecting everything. Thank you. And we're continuing at 5 minutes past 10.